Hi, I'm Gordon Kelly, and I'm here with Fern Zimbalist. And today we're going to be discussing on how you can be a more proactive patient and be much more informed and how to help even your physician help you with your medical situations. How are you today, Fern?
I'm fine, Gordon.
Thank you for coming in.
Thank you.
And Fern is not a doctor nor a nurse, but a proactive health advocate.
Yes.
How did you start to get into this? How did this happen to become so proactive, informed, and to be, taking charge of your own health?
So many years ago, Gordon, I created a medical blue book. And this blue book was a timeline, kind of a diary of sorts for medical information for my family. My family was so happy that I had the foresight and the patience and the time to create the blue book. And inside the blue book, there are different tabs, and you can keep information on your lab reports and your MRIs and your ultrasounds and any pertinent medical information. And the reason why that's so important is so that you can take it to your doctor and have them review it, especially if you go to a different doctor who may not have your report or records.
And Fern, this is, you've got some stories and some experiences, and your family must be so grateful about this.
They're very happy that I took the time to create it. And it was so important because it's a medical timeline. It's a capture, it's a diary of information that they can have and then go forward with it to bring to other doctors at points in time. Sometimes if you go to a different physician or a different hospital, they may not have the records, so to walk in with the book and have the records is so important, and it doesn't waste the doctor's time.
And the doctors always must have been very grateful about that, saving them time.
Yes.
With that.
They were very happy that it saved them time.
And, but what about you? Do you have a blue book?
I do have a blue book, and my story was I would say to my family, who's going to create my blue book one day? Who's going to create that, take the time? And it turned out to be me. I had to create my own blue book over 20 years ago.
And how did you divide that book up?
So I divided it into the same categories of medical research, medications, lab reports, MRIs, ultrasounds, patient resources.
And what did you say about timelines before? What did you mean about that, a timeline? Could you talk a little bit more about that?
Sure. So when my time came and I had to record vital information about a health issue, I went to my doctor, and there was an issue that I had to address. And I created a timeline. She told me one day on a cold winter's night to sit down and make a timeline from 20 years ago to now. So every year I would put information about this timeline and record it so that if I went for a medical test, I would be able to bring that timeline with me to share the information about the medical history.
Now, that was from your first time. Now, one of the major reasons people go into a doctor's office is they're in pain. That's the #1 reason for a visit. So when you went in there, what exactly was happening? That you had this timeline, you had lab tests, you didn't have lab tests, you had results or whatever. What did you bring with you that first time to the doctor? Or you didn't bring anything at all?
So the first time that I had the visit with the doctor, there were some tests that I needed to go through and have, and she told me, take those lab reports. And I said, well, gee, how do I get a copy of those lab reports? So you sign a release if you're at a hospital, and they must give you those lab reports or request it through your doctor. Then I would take the lab report and put it in the blue book. So year over year, I would be able to have that information readily available to share with doctors.
Well, did anybody ever ask you if maybe that you wanted to get into medicine by making this book? Or?
My doctor said to me at the time, she's a very prominent surgeon, said to me one day, you've done all this research and you've done all this information after our first visit. And I went back, and maybe it was divine intervention, or maybe it was guardian angel, or just a strong conviction of spirit. But I researched so much information on this particular health issue that we revisited it not more than 3 months or 4 months later. And then I had the reports with me, and she took a look at the information and the research that I had from all the medical books that I read. Not that she's not a prominent doctor, she is, but I took the time to look further into it, and the outcome was very good. And I'm glad that I did that research, and it only enforced my interest to be medically proactive and take charge
And there was a good communication there.
Excellent communication.
But what about the idea that, you spend a lot of time with your doctor, they become very familiar, and sometimes are things overlooked, or there's...
That's a good point. Sometimes if you know a doctor for a long time, or you feel that they're telling you one thing, and you just feel intuitively that maybe I need a second opinion, maybe I need to go to another doctor to share information, and that's when your Blue Book and your timeline and your reports and the discs and all the information that you have that you've collected, you can then bring to somebody else for a second opinion. Do you know how long it takes for the second doctor to find all that information way before you get there? It's so time consuming, and I've experienced this with many doctors who are so glad that you come in, family members and colleagues and friends. I try to get everybody to create their medical Blue Book.
And suppose that you are, let's say, so ill that you might be unconscious. You might go up into the emergency room. And what about when you go to the hospital, as you were saying there, what about getting an advocate or somebody? Is that part of the idea of having this Blue Book?
So
giving people guidance?
If you're in a situation where an ambulance is called and
Yes.
you're not feeling well and you don't have somebody with you to be proactive and kind of take charge of your health, you need to create maybe just a little short one-page of your medications, your dosages, maybe a medical alert symbol if you're a diabetic.
Keep it in your wallet.
Keep in your wallet, or put it in your bag, or have it readily available. So if you have an accident and you're in an ambulance and the EMT says, what are your medications? What are your dosages? How often do you take it? If you can share that with them, that helps them bringing you into the hospital and having your history readily available.
Now, when you also talk about going to a hospital, what about something a lot of people don't know about your Bill of Rights? Proper diagnosis, understanding, language. Could you elaborate on that? And that would also be incorporated in your part of your Blue Book.
So if you've never had that unfortunate experience to go to an ER, when you go into every hospital, they have a sign. It's a patient Bill of Rights, and it states that they are supposed to, in a very strong way, communicate openly and have correct diagnosis and have support for you. And most people don't realize that there are patient liaison reps in the hospital to help you. There are social workers there to help you. If you're alone or confused or afraid or concerned and you're not getting what you need in that chaotic atmosphere, and it can be very chaotic in an ER.
In an emergency room.
In an emergency room, and if you're alone or you don't have an advocate, a family, or a friend to help you, there are people in the hospital that can. But the Patient Bill of Rights is really important, and I don't know if everyone's really ever taken the chance to look at that. And you can see it online as well.
And this advocate, the advantage of having a patient advocate is, number one, they might be a translator. You might speak a different language. You might be traveling from abroad, or you might be overseas or in a different country yourself. But that patient advocate, what's the advantage of that?
So having a patient advocate in the hospital, I think they call it a patient relations representative, they're like the spoke in a wheel. They are the center person that communicates with the doctors, with the nurses, with the family members. They are the ones in the hospital that can help you advocate for your health.
And would they also be a better communicator with your doctor or your nurses, that advocate?
So they're there to assist you or any family members if you're not getting the assistance that you need, but to better communicate with your doctor or nurses when you see them. When you leave a hospital, you want to make sure you sign a patient release form and follow up with your doctors. And when you leave an ER or a hospital admit, they give you a discharge paper with instructions about how to care for yourself. And
sign a release form.
yes, sign a medical release form so you can get your medical records and put them in your Blue Book.
So you can receive this information and you'll put that into your Blue Book.
Yes, you put it in your Blue Book, and then when you go to see your doctor, again, it's readily accessible. Some doctors who are connected to the hospital that you go to can look it up online. They can view it there. But then again, if you go to a different doctor that's not affiliated to the hospital you went to, that's where the organization of the Blue Book is really strong.
You could be away. You could be out of town on a holiday and have a medical emergency. Now, I think that this was maybe your Medical Blue Book was born out of a necessity?
It was born out of necessity. It was born for family and friends and timelines, and at the time they didn't see kind of into the future, and knowing that here was this book that they would have for 20 or 30 years. The book started with a small divider, and then it got bigger and bigger and bigger because it's got a timeline of many years.
Now, part of this show this afternoon, I'm here with Fern Zimbalist, proactive health advocate, and we're talking about being an informed, a proactive patient, and also in charge of taking care of your own health. Now, as far as being informed, could you elaborate what you mean? We've got you're being informed, you're proactive, and I'm taking charge of my health. Now, you're being informed not only for your own sake, but isn't this also going to help your primary caregiver that's in your neighborhood or your community that knows you for years? It's also going to help you be informed when, God forbid, or something you do have to go to the doctor or an emergency room. It's also going to help the doctor.
Yes, it helps the doctor save time. Most doctors maybe have 15 or 20 minutes to visit with you, and I hear over and over again that if you come prepared for the medical visit and you have a list of your medications and your dosages and any concerns or problems that you have, they have a very limited amount of time to sit and visit with you. If they could receive the information when you meet them right away with your medications, your dosage, your history, your medical issues, it would save them a lot of time.
And Fern, if I may, out of this Medical Blue Book, you have it divided into sections. And with that, some of those are, you're going to have your appointments.
You're going to have your lab records, any discs you have from ultrasounds or MRIs, information about patient portals. This is really important when you go to a doctor and they say you can get your lab reports online. They give you a password. You go online. You can email your doctor through the patient portal, and you can see your actual lab report there.
And one of the things I'd mentioned about appointments, would you also want to have maybe doctors' business cards in there?
Yes.
And I was reviewing some of the things. Doctors, timelines, now you said about DIS. Now, what about this idea of being informed to see positive or negative lab reports? Tell me about, is that something online that you would go, or is that something?
So I remember when I got my lab reports, I'm not a doctor, I'm not a nurse, but I was
Yes.
trying to figure out in cholesterol which is the proper range and what's important and what's not. So I looked online, and there's so much information on the website to teach you how to read your levels and what's important, so that when you understand something's in the high range or the low range, and it says that actually on your lab report, that's another opportunity to ask your doctor, well, if it's high or if it's low, what should I do about this? And they usually communicate that to you, but you want to be captain of your own ship. You want to be proactive and look at your lab reports and try to teach yourself or learn a little bit more about it, and you can do that online.
And I like that in this book you also talk about following the directions. For instance, if you were a diabetic and you had wound care, and something that you said, it's very, very smart that you underlined about how we retain things.
So people retain more what they read as opposed to what they hear. And when a doctor gives you a discharge note from the hospital or from the office visit, they're telling you, follow up, take this medication. If you have any questions, email us or call us. And you know who's really wonderful with helping with this is the pharmacy. They are so smart, the pharmacists.
I was going to ask you about that. Now, one of the good pharmacists, they're going to compare medicines for you. They know you. They're going to find the price. Maybe they might have coupons, saving money. Some of the other programs that you might want to mention. What is this patient assistant programs?
So a lot of the pharmaceutical companies have patient assistant programs, and these programs help you save money if you're indigent or you can't afford the medication or the copays are too high. Then you can reach out to them and ask them for assistance and help. The major pharmaceutical manufacturers of products have these programs, and it's out there. It's out there on the internet and the web and all accessible.
So I'm here with my friend, Fern Zimbalist, who has this great idea about a medical blue book, helping you to be much more informed as a patient to help your communications with your doctor, with your primary caregiver, a physician assistant. And one of the other aspects of this book that you have, Fern, your book here on My Medical Blue Book, is that about being proactive. Now tell me a little bit more about that.
So being proactive means, as you had mentioned briefly before, in your wallet or in a bag, having your information about your medications, your dosages, what's relevant for your medical histories, what you're allergic to, what's your blood type, all that information to have readily available. Have your pharmacy information, carry that around, because if they prescribe a medication, they usually ask you in the office, in the medical office, which pharmacy. What if they have two and they don't know which one to send it to, and one is open later than the other?
Oh, that's a big time saver, because sometimes you have medicines you had something that needs immediate relief, pain or infection. So you'd have a list of your doctors also?
Have a list of the doctors.
As far as being proactive, you've got this blue book, and you're going to have, in your wallet or on your bag, some of your doctors, phone numbers, fax, and you're going to have your insurance ID cards. Mm-hmm. You're going to have dental and vision cards, medical, Medicare, and part of that proactive. Can you elaborate a little bit more about being, not only now we spoke about being proactive. Talk about that a little bit more.
So, being proactive and having all this information on you, you really want to save time and opportunity to do this. So when you're medically proactive, you're taking charge in your next step of saving time and keeping yourself healthy by having all this information.
Now, being proactive, I think that you mentioned about having medicines that you can and cannot tolerate.
Yes, it's very important. Yes, very important. If you have a list of medications that you can and can't tolerate, then when the doctor goes to prescribe it and you're sitting in the doctor's office speaking to them, and I can't take a certain product because it upsets my stomach. If you know that in advance and they're prescribing it to you, you could speak to your doctor right then and there and say, that medication doesn't sit well with my stomach. I need to have another one. But who could remember all the different ones?
No, you're under a huge duress. You might have a bump on the head. Maybe you slipped and fell on the ice or had an automobile accident. And one of the things that's in part of being proactive with this is also a history of surgeries.
Timelines, surgeries.
And dates.
Dates.
And the type of surgery that you have had?
Type of surgery. Usually they'll ask you, do you have any pins or metal in your body? What experiences have you had before medically?
Medical conditions? Existing medical conditions?
Relevant information to your medical history, because only you could remembering that in an accident, a time of emergency, to have that on you. Or have a little booklet. If you don't have your blue book with you, put it on a piece of paper, or there are
maybe I could show that
yes,
too.
I brought that to show, the medical book.
Oh.
There is a personal record for healthy aging that I found at a health fair with the Department of Aging, which is really a wonderful little booklet if you're able to take this with you, or remember to have it in the car or in your briefcase, and it talks about medical information, everything that we spoke about.
And what is this other one that you have here? A disc that you're keeping? This is inside of your blue book that has all these relevant terms and your conditions and everything. What is on this disc? This is a...
So that's an actual disc with an MRI report on there. An actual disc that I was able to receive from the radiology division. And so this disc is really important because when I go for a follow-up visit to another doctor, let's say for a second opinion, I can bring the disc with me, and they put it in their computer and they're able to see the report right then and there. Most of the time they'll have this report, could be your back or your knee, but they'll also include in there a radiological report, an actual report talking about whatever your condition is.
This is really, really being proactive. This is really being proactive, and particularly, I did a show here on baby boomer bust, and we're talking about 10,000 people a day are turning 65. Now, this, the disc and having these medical records and books, that's really great if it's not an emergency trauma, car accident, or something like that. But if you're going to see your doctor, and a new doctor, or changing doctors, that or move, perhaps you've moved to another town, that's great to have. That's part of being very proactive. And I'm with my friend Fern Zimbalist, who's a proactive health practitioner, no,
Advocate.
advocate, and we're talking about her having a medical blue book in which you have all of your medical records, and inside of there, about part of having this blue book, this was born out of necessity. Family and friends ask you all the time, and several of the aspects of it is that you're informed, you're proactive, and I think one of the other last sections we're talking about is that you're taking charge of your health. Could you elaborate on that a little bit?
Absolutely. You want to utilize patient portals. Patient portals. When you're at the doctor, they'll give you a password to go to the portal. There you can put in your passcode and get your information, recent lab results, test results, communication with your doctor. How did the medication go? I'm not feeling so well. I need to try this. It's an open line of a dialogue.
And it's not only that, but it's what you don't know and that what you should know to ask. And as far as only asking a question, how about that trust that we spoke about earlier, being familiar with a doctor? Then you say your trust should only go so far, and to trust yourself.
Trust yourself.
You know,
We've all had those experiences.
You know your own,
yeah.
as the examples you give with podiatry or breast cancer or something. And what about the idea of a second opinion? Now, this is taking charge of your health, healthcare. Now, you're going to utilize the portals. What you don't know, this is taking charge. Now, this is getting a second opinion.
So it's important to get a second opinion, certainly because they have. They'll see you as a fresh eyes, as a new patient. They might prescribe a different medication, or they might have a different path to take. And so when you go for a second opinion with a doctor and you bring your relevant medical records and your timelines, that's really important for them to see.
And didn't you have a little anecdote about a bicycle? Or?
I do. I have a friend that's a doctor, and he's always saying, don't take your bicycle to a car dealer. Take your specialist of your problem to a specialist. Cardiologist for your heart.
What a biopsy is?
Biopsy, maybe an interventional radiologist, someone who specializes just in the particular kind of radiology that you need for a biopsy. Know your patient bill of health. Know that there's concierge medicine out there. There's telehealth. These are doctors on call that you can call to save copays.
Oh, that's a great. I hear that's really up and coming.
So timely. And also, taking charge of your health means being proactive and vetting your doctors. There are all kinds of sites to go to look at your doctor's backgrounds and what people are saying about them.
Well, I like that you said that patient bill of rights and how to navigate being proactive. Your patient bill of rights, how to navigate the emergency room. You spoke about a patient liaison, social worker. You're talking about telecommunication, call a doctor, and by calling a doctor, you're also going to save
time.
A copay.
And your copay.
I read that in here. Now, referral services, part of taking that, vitals, health. Let me see what else that we have as far as familiarity. We spoke about that. Doctor's visits. The clock is ticking. Don't waste time of your doctors. Come prepared. Oh, and this is a very important one. Tell the truth. How you feel about your concerns. And what are those concerns?
That's very important because the time is limited that they have with you. And you might minimize something and think, oh, it's not that important. It's really not relevant. But that's all part of your picture and your health. So your doctor should know your complete profile.
And that would also be being prepared with your medical history.
Yes, having
and
a
this
relevant
is better to communicate with the patient and the doctor, with the nurses, because they're really, the nurses really don't get enough credit. With their experience, they're so well informed with that. And now you're also going to ask for basic, complete blood chemistry labs. Why do I need to tell the doctor to do this? To be on the same page? The same team? Or
if you're going to the doctor, let's say for your annual visit, I mean, sometimes that's done and sometimes it isn't. It depends. If you go to a second doctor and you'd like a baseline test, you've never had a if you have a back condition or a bone density
Bone
test.
density, yep.
They want you to have a baseline now and then take another one 5 years from now to see your bone health, that it's healthy.
And part of that, taking charge of your health, when you decide where your primary doctor, the names, you're going to want to communicate with others, physicians for the hospitals, and you want to keep them in the loop so your reports can be scanned in and upgraded and maintained. Now I'm just looking at, and now they also have office reps, and they'll also show you how to go to a patient portal. That's going to save you time, save concerns. Well, this is really, it's, now what about this other one? Discuss medications you have been on for a while with body changes, research updates, keeping informed of new medications on the market, research, and taking charge of your health to ask questions.
If you've been on a medication for a few years and there's something new on the market, maybe your body gets so used to it. There was a big controversy about Fosamax many years ago and how that was affecting health. And so if you're reading about this and you've been on a medication for many, many years, it's time to maybe revisit it with the doctors. They can't, you know, they might look at your report, your chart, but it's important for you to be proactive and bring it up and mention, I've been on this medication for so many years. Is there something new? Should I change it? How does it affect my body?
So you're going to have this blue book. And what are the 3 bullet points you're going to talk about having this book? That you are?
I'm an informed patient, I am proactive, and I'm taking charge with my medical blue book.
And before we review that a little bit and go wrap up the show shortly, tell me, didn't you have a story you just had yesterday?
I did yesterday, yes. I went to visit a friend in the hospital and their family was there, and it was very serious surgery. And they were sitting in the waiting room and there was no one coming to them to giving them updates, and they were very concerned and very nervous. So I said, well, where's the patient liaison representative? So they didn't know what that was. They didn't know that there was such a person in the hospital that could help them. Eventually they would have met that person, but we just jump-started it and went down to that department to find them, got their business cards a little bit ahead of time, and they felt a little more assured that they would have eyes on their
so
family
glad you were
member.
there.
I'm so glad I was there too to help.
Now we're just going to wrap up quickly that we were talking about Fern Zimbalist and her great idea of being your own advocate, to say it again, what are the 3 points there?
I'm informed, I'm proactive, and I'm taking charge with my medical blue book.
Oh, that's really great. That's really great. So they must have been very grateful for you. They must have been very grateful for you. I want to thank you, Fern Zimbalist, for being here today.
Thank you,
with the show. And just this is really great. This is something else.
And here's to our good health.
Yeah, absolutely.
The audience as well.
Absolutely. Thank you for tuning in.
Thank you.
Thank you. And we're just going to keep talking right here.
This is great.
And just as if